I remember meeting someone in about 2007-8 who said, I love your website. He said, oh, I don't use it for me. I'm a mental health caseworker and all my clients have debts and I need to sort them. And a few years later, I'll phrase them, my own dark days, where I struggled to get out of bed and life was pretty difficult. I remember at the time, obviously doing what I do, thinking, thank heavens, I can still pay the bills and I don't have to worry about that. What on earth would I be doing if I couldn't? I vowed at that time I was going to do something about it.
Money and mental health problems are so fundamentally linked. When we're struggling with our mental health, it's harder to earn money, to stay on top of money, to control our spending. And when we're struggling with debts, it has an enormous impact on our mental health. And those two things reinforce each other into a vicious cycle that is so hard to break out of.
We're a research and campaigning charity working to break that cycle.
The research community has been at the heart of everything we do at Money and Mental Health since the very beginning. It's a group of around 5,000 people with personal experience of mental health problems. Lots of our research ideas and campaigns come directly from the research community, and we also go to them with our policy ideas and changes that we'd like to make.
Anyone with experience of mental health problems is welcome to join the research community. You can just sign up on our website.
In 2013 is when I developed poor mental health, which led to obviously being sick off work and having issues with a missed council tax payment.
Because you have no sense of future, so I never thought I'd get to my age. I wouldn't plan for money. What was in my bank account was there, and when it was gone, it was gone.
When I'm not in a good place, it affects my money, and obviously when I'm struggling with money, it does affect my mental health, yeah.
It was a huge rule that we wanted every single policy we come up with to be steeped in lived experience. No matter how clever you are, no matter how steeped in policy or economics you are, if you haven't lived that life, you can't know how it feels.
I decided to join the research communities I found when I went back to work after being an inpatient in a mental health hospital, that my colleagues struggled to talk to me.
At that time I was kind of worried about how I was going to manage on discharge and stuff, so I decided to join, and it's been really useful.
You were really upfront about you don't have to answer anything if you don't want to answer anything. We won't bombard you. Just every now and again this survey would pop into my mailbox. And subject after subject, it was something that felt like my experience.
Being part of the community, for me, it turns a negative experience into a positive. It means I can use when I was in poor mental health to make sure other people don't face similar issues.
It was really good to see other people in the same situation and to feel like I'm not alone.
It almost gave me a sense of purpose again. And I know that sounds quite big for something as simple as filling out surveys, but those surveys were turned into reports. In those reports, there were stories from people like me. And so that felt important.
I'm so proud of the impact that the organisation has had over the last 10 years. It's things like introducing a new debt respite scheme for people who are using mental health crisis services, improving debt collection letters that banks have to send out to people. We've got that wording changed, stopping GPs charging people for evidence about their mental health that they need to show to their creditors. We've seen significant improvements on council tax collection, which is enormous. One of the biggest things that I think we've achieved so far is that the link between money and mental health problems is no longer news and is no longer interesting. 10 years ago when we started, most people in organisations had no idea that they were linked. That has fundamentally changed. The link is fundamentally baked into the financial inclusion strategy, the suicide prevention strategy. It was baked into our response to COVID. It's baked into the UK's financial wellbeing strategy. In the next 10 years, there are some sectors that are still further behind.
I want to see bailiff regulation coming in. I want to see debt help embedded in mental health help. I want to see minimum standards on current accounts to help carers and people with mental health. I want to make sure that the charity continues to do detailed research embedded in real people's lives and still get listened to. And I hope we're still trumpeting about it in 10 years' time.
What I'd really like politicians and service providers to get their head around is that we're not victims, we're vulnerable. So stop treating us like a political football. I don't need to be told that what I'm experiencing is not really bad enough, not really an illness. I need some help to deal with the practicalities of having that illness.
Just think more about how things could impact someone, because poor mental health affects a lot of people.
Anyone could experience mental health difficulties at any point in their life, but it doesn't take away who they are, and they still deserve to be heard and to be listened to.
If I had one message for people watching this, we cannot do this without you. We need people with lived experience of money and mental health problems from all walks of life, from all ethnicities, ages, to get involved and to tell us what are the issues you're facing and to respond when we ask you, because we want to give you the agency to help us make life better for everyone with money and mental health problems. Please join our research community.